LimbsNThings. Hello, everybody, and welcome to Pull Up with Limbs and Things. We are talking tonight a little bit about cleanliness and how it affects us as we age. There are so many times that I go into homes of all types where there are pets, where there is potentially just some people who have gotten older and are not able to clean as well as they used to. And so tonight we've brought Miss Emily Head. She is the owner of Southern Belle Cleaners in the DMV. And we're going to talk a little bit tonight about aging and about cleanliness. So welcome, Miss Head. How are you?
Oh, easy breezy. How are you doing today?
I'm good. I'm glad to have you. And I want you to tell us a little bit about Southern Belle Cleaners and then how some of these things affect the aging adult population.
As you said, I own Southern Belle Cleaners. So we do commercial janitorial for office building and churches, and then we do property turnover for realtors. But our specialty service that we're super passionate about is extreme decluttering, where we really focus on helping seniors and those who are just kind of in a bad situation and just help them return back to a healthier living condition.
That's awesome. I think that is something that aging adults don't necessarily know that they need. We're so used to
Yeah.
cleaning up for ourselves that we don't think we need the assistance in cleaning up like we possibly should as
Mhm.
we get older and we just can't do it. So
Yeah.
from a physical therapy standpoint, we think of cleanliness from the safety aspect and thinking
Mm.
about the
Fall prevention.
right, and the high traffic areas and just making sure when someone is coming in your home, when you're using your main areas like your bathroom, your kitchen, your living area, or your bedroom, that you have clear spaces and it's decluttered, kind of like what you talked about. So, you want to tell us a little bit about the program that you just mentioned?
In essence, what happens is that that's how a lot of our clients are actually identified. So they'll have a fall in their home, they'll have some kind of emergency in their home.
Mhm.
EMTs will be called out, and then EMTs will identify that if they're living in a poor living condition, and then they'll contact social services, and then that's kind of how we get wrapped into the whole situation. And so it's more just. We tell people all the time a clean house is so many different effects from prevention, which, I'm sure, like you said, you see it every day. When my grandmother fell, she just was never the same after she broke her hip. I mean, it was
Right.
just like she was on like a decline, after that, after she broke her hip. And then you have infestation. A lot of seniors suffer from bed bugs. And then, a lot of times people really like to use the term hoarding. Well, really, it's not hoarding. It's just, somebody has been living in the same house for 20 plus years. Items have accumulated, as well as their mobility has changed. So they can't really clean the way that they previously were cleaning. So it's kind of like a combination of a lot of different things that all wrap into how we get to this situation of a cluttered home.
Absolutely. I think that's important what you mentioned because, yes, we often think if it's a lot of stuff in there, it's hoarding, but it could just be, yes, you've accumulated a lot of different things. So, is there a difference
Mhm.
between hoarding and just accumulating stuff? What makes it hoarding?
Yes, it's a huge difference. So for us, I've been in business since November of 2020. I would say maybe only 20% of not even 20, maybe 10% of our clients are actually hoarders.
Okay.
Uh, 90% are just either in poor mobility or either suffering from depression. So it's a huge, huge, huge difference. So a lot of times we'll go in there, start grabbing, the bags, and they're like, hey, throw this away, throw that away, throw this away, throw that away. And
Right.
they welcome the assistance. They just had, like I said, they become on hard times. They just really haven't been able to efficiently clean their home. And so it kind of just escalated downhill. And we do have we do have maybe 10% where it's, hey, I can't let go of this blanket, and everybody has different things. Some people, they hoard books, some people they hoard, so it's all kinds of different things that people like to, hold on to. But what I like to tell a lot of our clients is that if you get rid of it, it doesn't get rid of the memory. It doesn't get rid of the memory at all. Like that,
Mhm.
the story that I tell a lot of people is that so when I moved here right before I moved here, my grandmother passed
I'm
that
sorry.
summer.
Mhm.
And oh, thank you. And so my aunt gave me a hat that she was a church wearing hat woman, and so she gave me a hat that she had bought her for Mother's Day years ago. And so she gave me the hat, and I took the hat and I put it in a closet. Well, when I was moving here, I was packing and I was like, am I going to sit here and take this hat? But then I was like, this hat is my grandmother's hat. My aunt
Right.
gave it to me. It was from Mother's Day. My grandmother's not here anymore. So, was all these emotions tied to this hat. And I really thought about it. I was like, I'm never going to wear this hat. I'm not a hat person. I
Yeah.
was like, let me take a picture of the hat, keep this memory of my grandmother, and then give it to some woman who is going to wear this hat every Sunday. And
Yeah.
so that's what I really like to try to share with a lot of my clients is that just because you let go of a blanket. I had a client one time that she was like, oh, my mother gave me this blanket when we went to Canada and I was 6.
Mhm.
And so she was just keeping this blanket in this little container, because her mother had passed. And I was like, it doesn't take away the memory.
Right.
It doesn't take care of the memory. And we most definitely don't try to force anybody to get rid of items that they're not ready to get rid of, but
Mhm.
we do like to have people evaluate, what items needs to be kept and what items need to be let go. And what we really see a lot of is that when people downsize, they coming from full size homes
Right.
and they didn't properly evaluate what was important and what's not important. And so they go into this smaller place and now they're in this situation of like extreme clutter.
Right.
So that's another thing that we really see a lot of is just not efficiently evaluating the items before they downsize.
Those are all really good points because depression definitely plays a big
Mhm.
role in some of the homes that I see, as well as those who probably have had someone who's passed away, no longer living there, maybe recently, maybe a few years ago, and they just haven't decided to part ways with some of the things of
Mhm.
that other person. So, do you guys also do, what should I say? It's not decluttering, but just ridding the home of um, loved ones' clothes that are no longer there?
Yeah, so we do a lot of donation drops off. We got a van. We are on a schedule where some people, they'll go through it at their own pace. We have about 3 or 4 clients that we'll go to every other week. We'll collect items. We take it to the Lupus Center in Hyattsville, and just donate it to somebody who can use it. Some of the items can't be used, and
Mhm.
some items are not in the condition that needs to be passed on. And we'll inform them of that. But yeah, so we have a lot of clients who they'll just slowly go through things at their own pace. Because everybody has different. Like I said, if I had stayed, in Tennessee, I might still have my grandmother's hat now.
Yeah,
It was just the timing to release that hat was, it had approached and I was ready to release it. So those are different kind of things. You just got to figure out what timing works for you.
absolutely. So I've
Hmm.
had a patient who is, she was in her 90s and she used to get on her hands and knees and clean her baseboards. I don't do that. But there are some people who have had rituals of how they clean their home, but they're getting to an age where that's not a possibility for them.
Yeah.
So, what
Yeah.
alternatives could you say that someone could have or use for doing a clean job without doing it the way that they used to?
Well, we do a lot of, I call it, the classes is called Clean Like a Belle. So we do a lot of workshops. So if anybody out there is interested in one of our workshops, we do a lot of workshops
Mhm.
in the DMV area where, we'll go to senior centers and we give them decluttering calendars and just, talk to them about one of the main things that my first thing that I preach all the time is that, baby, we got to upgrade that vacuum because people the vacuum that you had in 1970 is heavy, it's clunky, it's very difficult, it's got the cords,
Right.
it's a Hoover. And so one of the things that happens is that are like, oh, this is just too much for me to use. They're more fragile. And so they'll stop using it. And so that's when they just kind of get into this like decline. So they're like, oh, it's too much to vacuum. Then so I tell everybody, not that I make money off of Dyson, but I really encourage people to get the Dyson sticks when they're of a certain age, because they're just easier for seniors to use.
Uh-huh.
They are a lot of them are cordless, and they can just charge it, and so it's just a lot, less probability that you will fall, or without with the cordless. We talked to them about mops. So what the mops that we were using 20 years ago are disgusting now. Like they're these mops that you have to hand wring.
Right.
Like, I'm over here telling them, like, go get an old cedar, go get a Lipman, like go get these things that are making it, because like, I had to just tell one of our seniors the other day, my young ladies were bringing, we're trying to encourage her to get another mop. And so she was like, telling me about the mop. And I was like, listen, what you got to understand is that when our young ladies are cleaning and they're mopping, and now they're taking the mop out, they're having a hand wring it. They're not going to the bathroom to wash their hands from wringing this mop. So
Mm-hmm.
now you have on their gloves whatever was in this mop water. So,
Right.
I was like, these are the kind of things that you need to think about. So it's just a lot of newer technology, that a lot of the Swiffers to help with dusting. So it's a lot of things that, during our workshops, that we really encourage seniors to, it might cost a couple of dollars, but, it makes it easier for them to complete their cleaning task.
Those are really good tips. I oftentimes talk about these Swiffers because I see a lot of people wanting to get on their fans and clean the blades, and just knowing that a long handle Swiffer will help you do that.
Yep.
So
Mhm.
yeah, I'm glad you definitely brought that up. So
Mhm.
let's talk about COVID and cleanliness and sanitization after, because I'm one of those people that go into people's homes. But if someone has had COVID, I'm giving you some time to air out your house and clean it up. But
Yeah.
if there are sanitizing methods that we can do at home post COVID, can you share those?
Well, it's really, that's a touchy subject, because to be transparent, it depends on the person's chemical level.
Mm-hmm.
So it's a lot of people who are very like anti bleach,
Mm-hmm.
anti so those homes, we encourage the, Mrs. Myers, and wiping down the surfaces, and she has a lot of like very good disinfectants that don't have a lot of the astringent, chemicals. But we have a whole list of areas that we, advise people to make sure, you're wiping the door handles down. You're just key, when was the last time you wiped down the door handle on your refrigerator? So those are the kind of things and tips that we give them to wipe down. But so for us, how we handle the homes, we tackle it with Clorox. We'll go through the whole house, and we have like like I said, an itemized list of areas that we touch when we know that there has been a COVID patient in the home, or it's really, sometimes it's more than COVID. We deal with people who are dealing with a lot of different illnesses, and so once they go to the hospital and they're released back,
Mm-hmm.
we just have to make sure that the house does not still have those same germs from when they were initially sent to the hospital.
Very good. Very good.
Hmm.
Okay. What would you say are one of the dirtiest areas of someone's home?
So what I tell people all the time, because we come across a lot of children who are like, I didn't even know my mom, was living like this. Like, she's just coming to the front door. But I've really been trying to like encourage uh caregivers, people who go, and nieces that go and check on people, go to the kitchen and the bathroom. Like the living room, they can mask a lot of things just
Mhm.
poking your head in that living room, but you really have to walk to that bathroom and you really need to walk into that kitchen because those are the two areas where it's a little bit harder if you're not maintaining. They're a lot harder to to disguise. We'll see infestations, or we'll see just unkept bathtubs, unkept toilets. And so that's kind of how we can measure, like, okay, what's really going on in the house. Like if we go, when we do a consultation, you
Mhm.
know, okay, yeah, living room. All right, nah, I need to, people will take pictures of the living room. We're like, no, we have to see that bathroom. We have to see that kitchen. And like, I encourage everybody because, especially like with the kitchen and dishes, you can really evaluate how well they're just upkeeping the house, just even by basically just checking out the dishes situation, looking in the refrigerator. Are they throwing away rotten in food? So that's even like, I've had some people even like find out that people are beginning signs of like dementia and like more serious senior issues, because when they go to the refrigerator, the person is eating spoiled milk, or it's like
Right.
little things like that, where previously they would have caught it, that now it's kind of like going over the radar of like, hey, this is getting into a bad condition.
Yeah. So you touched on my next question, which is when you have caregivers that possibly are not living nearby, they can't necessarily go by and see what's happening. What are some things that they can look out for or be asking to know if their loved one's home is clean?
So what the best thing that, and I mean, and not everybody can, do this, but I tell a lot of people to get their families those small Alexa with
Mhm.
the cameras, and force them to. Alexa came on, but force them to, go set it up and then get it where they can just touch the button when you call,
Mhm.
and then you can kind of survey the area yourself. So because there a lot of times we see seniors that are kind of deteriorating, and they're kind of like blinders are up, and they're not even like, oh, well, I was about to move that. Well, no, it's sitting, it's blocking, the walkway. Like,
Sure
like
enough.
they'll put their cat food, in areas where it's clearly blocking, so it's like those are the kind of things that, if you're not there, because honestly, you just asking questions, they can easily, not to be not with ill will, but they could be telling you the wrong thing just because they're have their blinders up. But if you get those, a few of our clients, I've talked to their children, and they've set up the Alexas, and those have really been able to, see like the areas where and they set it up in the main areas of their home, so they can kind of see the condition, and then you can also kind of see the person's condition too, so it's kind of a
Right.
win-win. So it's not just because honestly, for just a little small fact about us is that, so we started with commercial cleaning, and then we were approached about a woman who was forced facing eviction due to the her housekeeping, and so she had an
Mhm.
infestation problem. And so when I went in there, she was, what I later found out, she was a solo ager. So we deal a lot with those who do not have either any family in the area, or never had children, or never been married. So we see a lot of people who are kind of almost forgotten, and that's
Right.
one of the things that I would like to suggest, is that they have the small monitors. It's easy for them to operate, and you can see here, and you could put, put eyes on them, because even if you are FaceTiming them, or Google Meet
It's
with
there.
them,
Right.
it's right there.
Mhm.
That video is capturing a lot more of the room.
Right. Very good points. So if you're watching, you have a question, please put it in the comments. Pull up with limbs and things. It's a challenge, something you know. to confirm something you don't know and to give you an opportunity to share that information with someone else. And if you're watching it live, you can always hashtag live like this. And you can hashtag replay if you catch it on the replay. Miss Marsh says, love this topic, something we as PTs may not refer patients to as this is valuable service. I'm interested in the workshop. I have a referral for you. I'm still working, so I'll connect later. Thank you, Dr. LimbsNThings and Miss Southernville. You're welcome, Miss Marsh. Okay, Mr. Bowen says, what about the children carrying germs from school into the home, and how can we clean our homes better?
And so, like I said, we have a short list of areas to focus on.
Mm-hmm.
Like I said, doorknobs, refrigerator handles, and just those common areas. It's not a long list, but it's just the common shared areas that are, being touched by pretty much everybody in the household. And
Mm-hmm.
so I don't know if it's a way that I can share that list, but if you reach out, I can give you the
Sure.
list of like key high traffic areas where we suggest people, and we're not big fans of, I shouldn't say it like this. We don't mind Lysol wipes, but we are more into actually like using the saturated, sprays, because a
Okay.
lot of times we'll, especially in seniors' homes, they'll have them, they're dried out and they still trying to use them and it's not effective anymore. And so that's the reason why we really encourage people to take the time, especially, during this time of the year when a lot of people are catching colds, children who are new to daycares, that are going and visiting their grandparents. So, and whenever you're interfacing with those different situations, make sure that you are, you know, fully sanitizing those areas.
Absolutely. Okay, so I know you talked about the living room being a super clean area in an older adult's home. Have you found any other areas that you find this is one that they definitely clean?
I mean, to me, like the living room, a lot of times is more like masked, I guess I would say.
Mm-hmm.
And then you'll go into the bedroom, and then you can really see how things might be deteriorating. But I mean, really, honestly, it's the living room, because a lot of times the bedroom, the spare bedroom, the bathroom, and the kitchen kind of are all like, all over the place. But the
Mm-hmm.
living room will, still, because they'll have that probability of somebody popping in or coming in. So they want to have at least the living room cleared to a certain degree so they can. But, after COVID, a lot of people, stopped visiting people. So a lot of homes really went down and really were deteriorating because they were no longer forced to, entertain. So now they're, in these homes where they're not getting that inside contact. A lot of our clients live in senior buildings where they weren't allowed to have any, guests at all,
Right.
so like for a whole year, you weren't so one of our clients, um he was, when we talked to the cousin, he was doing fine, he had no problems. They would come and check on him, drop off food. Well, at his senior center, they cut off all visits.
Mm-hmm.
And so fast forward February 2021, he's about to get evicted because of his living condition. And it's because he no longer had that family member who would come over, pick this up, pick that up, oh, wash a couple of dishes. He no longer had that, and he just wasn't maintaining the household. So, but really, honestly, it's only the living room that I would ever say, that it's probably the cleanest area that we'll see when we go into a home that's, very cluttered.
Gotcha.
Because
Okay.
even the bedroom will find, that it's not clear walkways, or like they only got the walkway to go to their bedroom, but I mean their bed, but like on the other side of the bed,
Mhm.
um, they throwing clothes and all kinds of different things.
Right. Here's a question for you. Have you ever had to clean a place like we see on the show Hoarders?
Yeah, 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 yeah. So, long story short, I didn't plan on doing this at all. So, like I said, if I hadn't met the young lady who was about to get evicted because of her infestation,
Mhm.
I sat down and I talked to her. She was from the South. I'm from the South. She's never been married. I've never been married. She has no children. I have no children. And so a part of me was just like, hey, like in 20 years, what if this is me? What
Mhm.
if I'm, forgotten and just sitting in an apartment and nobody is checking on me and I'm just, and it's not even like a serious depression. Sometimes it's just, life is just, it gets mundane and you can kind of get sad. And so she like basically changed the whole trajectory of my entire life. And so that's how we got into the extreme decluttering. So we love going into the homes that you see on Hoarders because those people need our help.
They do.
There's a lot of cleaning companies that do not want to go into. So how we realized that we had a niche is because a property manager or somebody will find a infestation or have a leak in an apartment or have some kind of issue, and so they'll contact a exterminator. The exterminator say, hey, we can't go in there until it's clean. So then they'll contact a cleaning company and like, well, we can't go in there until it's exterminated. So it was just like this battle. And so then once they met us, we're like, okay, yeah, like, okay, it's a infestation. We have mice, we have roaches, we have bed bugs. Like,
Mhm.
okay, we'll just put our suits on. So it was one of those kind of things that it's one of those kind of things where we were able to really feel a need because a lot of cleaning companies don't want to go in there till it's exterminated, but the exterminator can't go in there until it's clean to a certain degree. So yeah,
Mhm.
we've been in homes that look just like Hoarders, where you literally are walking on, you don't know what you're walking on. You're walking on, I guess, maybe McDonald's cups. You don't even know what you're walking on. You don't know what you're walking into. You don't know if it's mice in there. You don't know if it's roaches in there. You really don't. We've been in those homes, but it's because those people need our services. It is something that's gone on. A lot of times, I tell people all the time is you don't know what the straw that will break your camel's back. So, it's a lot of times I went into one woman's home and the calendar was on March and we're in July. And I
Mhm.
was like, the first calendar, I said, okay. The second calendar, I'm like, okay, what's going on? Well, that's when she lost her mother. She had already lost her father. She wasn't married. And so when she lost her mother, she even stopped flipping the calendar. She stopped
Mhm.
taking out her cat litter and she just started pushing the cat litter. Once it got filled, she started putting it into another bedroom. So, these are the kind of things that you don't know. She probably didn't think that losing a parent would have put her in that condition. Or sometimes people losing a job, sometimes people go through a divorce. We've seen people where they've gone through the divorce, they're having to downsize to another home and they're just struggling with it. And so that's where we really like to come in. We'll put our suits on, we'll go through and identify what items need to stay, and then some items we can't you keep. We've gone into homes where the bed bug infestation was so great that every piece of wood in there had to be thrown away, so we had to throw away a lot of her furniture.
Yeah.
And so it does happen. So yes, we've seen a lot of those homes that you see on Hoarders. For us, what we've identified is that a lot of our clients are on more fixed income, so it's more one bedroom apartment. So we don't see as many of the large homes because a lot of times when they're in that large home, they're able to maybe afford housekeeping a little bit more, or they're in a little bit better financial state to kind of mask their the condition. But we see a lot of those homes, especially like in one bedroom, two bedroom apartments. And I tell people all the time, you'll never know like how it could be your neighbor living like that and you
Right.
wouldn't even know.
Right. That's good. I think we don't consider how much it is that the psychological aspect of what goes into a person's life affects their ability to do other things like cleaning their house, staying safe. And so as a PT, we tend to think about, okay, are the cords out the way? Is it a clear
Mhm.
pathway to get in the door for you to get to the places you need to go to your bathroom, to your kitchen, to your bedroom? Are you going over cords? Are you potentially having places in your home where you're holding on to something, but it may not hold you up? All of those things we look at. So, are there any tips that you have that you've seen um, from a cleanliness aspect that you would want to share with someone to keep them safe from your perspective?
So what how that is one of the main reasons why we get called out. Somebody has taken a fall,
Mm-hmm.
EMTs has been have come out, and then they're identified in this living situation. So that's most definitely, something that we see a lot. And that's the first thing that we go for, especially when we're in homes that are kind of more resistant. We'll let them know that our key things are clear walkways and clear passages to windows and doors.
Mm-hmm.
So, we'll say, hey, you can do all you want, but these are the two things that has to be done for us to have, success. And so one thing that I always say is that we go by is sort, set in order, shine, standardize, and sustain. And so set in order is really key for your home success. So what I really feel like a lot of times, especially in seniors' homes, we'll see unclear walkways are staging items. So like
Mm-hmm.
they'll have items that are kind of oh, okay, well, I went to the grocery store, I'm keeping it right here, and then I'm going to take it to the bedroom, or then I'm going to take it to, well, it's on the floor, and now we have this bag from Monday, then we have another bag of food that came in on Tuesday, and so now we have accumulation in this one spot. So
Mm-hmm.
now we're having to manipulate and move around this instead of us clearing the walkway. So we kind of get numb to things. So I always try to tell people is set in order. Find out where everything needs to go and force yourself to put it in that area, as opposed to you sitting here keeping things in unidentified areas. And so just take those extra 2 seconds when you coming in the home, putting all the cans up, putting all the items that are in a bag up. And then also just making sure that you just how a lot of times people like to keep stuff around chairs. That's not like that's one of our key things that we really try to make sure that people understand. Like, you don't need to have the all this additional items that are on the floor. But that's really, I mean, honestly, it boils down to is what we see a lot of is that people are not setting in order. They're not putting items where they belong.
Mm-hmm. That's big. I find that a lot of people in the aging adult population tend to have subscriptions to different magazines, and so they'll have those stacked up. We get
Hmm.
newspapers, and the person throws it up on your porch. You get it, and it might sit there because you're not ready to read it because you didn't finish the
Yep.
last one. Having items on your steps as you're going up, those things can definitely be reasons for
Hmm.
falling. So
People
be a cycle.
ordering, yeah, ordering off of ordering packages, not breaking down the boxes, and now that you have accumulation of boxes, and boxes can be bulky and take up a lot of room. So it's
Mhm.
like all of those things. But like I said, it boils down to, for us, it boils down to you not setting an order. You're not
Absolutely.
identifying where it needs to go and putting it where. And so that's when like I said, when we go to the homes, that's one of the things that we do. We sort, we find out
Mhm.
where everything is supposed to go, and we set in an order. Now we're not per se like professional organizers where we like label it, make it
Yeah.
cute.
Mhm.
We might not do all of that, but we do make sure that you identify okay, this is where I keep all of my toilet tissue. So, we'll go into homes and we'll see toilet tissue in the kitchen. We'll see it in a closet. Then we'll see it again in the bathroom closet. We really try to tell people, and then honestly, we found a lot of times that's how buying happens too, because you don't have things set in order, and then you'll have stuff
Neither.
in one place, and
Mhm.
then you'll have it in another place, and so now you're sitting here ordering because you didn't go to the other place where these are kept as well. So,
Yeah.
and I always tell people that even if you're not in a cluttered home, it doesn't hurt to we have calendars that we do where we really encourage people to take it area by area.
Mhm.
Like, when was the last time you went through your pantry?
Yeah.
I'm asking you.
Oh, so the beginning of the year, I try to do that
Oh,
every beginning.
okay, okay, okay. So you
Yeah.
got a good rhythm. So, we tell people to go through different areas and identify, like, okay, this is what I'm going to clean today. So, for this month, I'm going to go through the whole pantry.
Mhm.
Identify what needs to be thrown away, what I don't even use. So, like, even for myself, when I did it in my kitchen during COVID, the oatmeal that I used to eat, they stopped making it. You know how,
Mhm.
like, all these supply chain issues, so they stopped
Right.
making it. So then I stopped eating oatmeal. Well, I had this protein that I put in my oatmeal. So I've been passing by this protein on my kitchen counter every day for a year,
Mhm.
and I haven't bought this oatmeal or used this protein in over a year. And I realized one day, I was like, when I was going through everything, I was like, I don't even use this protein anymore. So it's things like that that are not even like a senior moment. It's
Right, right.
just life has changed, and
Mhm.
this is no longer something that's giving you value. And so we just need to make sure that we set in order. And so I was like, hey, this no longer needs to be sitting on my
Counter.
on my countertop.
Mhm. I got it. Okay, we have one last question. This is a great service to be aware of. I did home visits for care where you could hardly get in the house because of the pile of old papers and other things, and she would like to connect with you.
Yes. So I'm Southern Belle Cleaners on everything. So Southern Belle Cleaners DMV on Instagram, Southern Belle Cleaners DMV website, Southern Belle Cleaners DMV LinkedIn, Southern Belle Cleaners DMV Facebook. So now I'm not that savvy on Facebook, but Instagram and LinkedIn, and then our telephone number is area code 301-485-9106. So please connect with us. Most definitely, that's why we're making this connection today, because, we met at a senior provider network, because what we realized is, after I was like spending money on Google ads and, Instagram ads, I realized, like, my ideal client is not looking for me.
Mhm.
They could care less about their home getting clean. So what I had to really do is find people who are already servicing my clients, and then kind of tag in my service, like, okay, well, hey, when you come across this, then this is how you can bring us in. But our clients are not looking for us, you know.
But I think this has been a worthwhile conversation, not just for the seniors, but their caregivers, and even for us as we're getting older and we're finding out, okay, I don't want to age like this. Let me see what ways I can make the adjustment now, like you mentioned about the protein that was sitting in your counter. So, if
Hmm.
there is a final thought that you have, please share it with us because we appreciate you coming through and telling us all that we need to know about staying clean as we get older.
So my biggest thing that I am just a big champion of is not going in with judgment. Lead with your heart when you are approaching these conversations. Especially, we've identified that when we're going into homes of people who look just like us, a lot of times it's way more critical, way more judgmental. And I think that a lot of people in the Black community don't 100% understand that 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 this is a condition. And I think that a lot of times we're way more dismissive, and so now this person is further isolated because they don't want to continue to receive this judgment that you're giving them. So I really want all of us to, when we identify family members that are in this situation, lead with love. Make sure that they understand that you are only there to help them, and that's what you are there for. And you only want to see them, live in a healthier situation, and just try to approach it with a kid gloves. Sometimes I understand you want to be like, oh no, we got to get this solved. Hey, I understand, but you don't want them to further reject you.
Absolutely. It's all in the way you say something because you never know exactly why they are in the state that they are. So
Yep.
I thank you so much. And if we want to contact you, you've already told us the ways on social media. Can you give your number one more time? Hold on. Let me make sure I got it. Okay, I'm ready.
301
Mhm.
485 9106.
All right. And here is her number. If you all would like to have services from Southern Belle Cleaners, the number is below. And this is the website you can contact. And if ever you have a need for mobile physical therapy, you can always contact Limbs and Things at limbsandthings.com. Our number is 202-643-2636. Thank you so much, Miss Head.
Thank you for inviting me. I'm glad we got to connect, and I invite
Absolutely.
everybody else to connect with me as well. I love to connect and share.
Absolutely. You have a good night. Thank you, everybody.
Thank y'all. Y'all have a good night too.
Bye.